If you notice any of these 7 symptoms, you could be just days away from having a heart attack, and you should consult a cardiologist as soon as possible. Every minute counts, because every minute that passes is heart that is lost. Saying that I am surprised would be little. The correct word is, I am alarmed. In the last 10 years, heart attacks have increased and affect more and more people under 40 years old, and especially women. I am Dr. Desa, and today I want us to understand together why heart attack cases are growing so much and why they are appearing in young and apparently healthy people, even in those who have never had previous heart problems. And I want to hear your opinion at the end. According to international organizations, cardiovascular diseases take more than 17 million lives per year. That means more than 30 people who die every minute. Not cancer, not traffic accidents cause so many deaths. The problem is that they are silent diseases. Many times we realize when it is already too late.
Why?
Because most people do not know the signs that the body gives days or even weeks before a heart attack. Today, I am going to teach you to recognize them. Many call this pre-heart attack or silent heart attack. And at the end, I will also explain why so many heart attacks are happening in people under 40. Why does a heart attack happen? The heart pumps blood to the whole body and also to itself through the coronary arteries. A heart attack happens when one of these arteries gets blocked, preventing the heart from receiving enough blood and oxygen. The main cause is atherosclerosis, plaques of cholesterol, calcium, and inflammation that slowly form in the arteries. Sometimes they take years to block them completely. But the most dangerous thing happens when an inflamed plaque breaks and forms a clot that blocks the artery suddenly. That causes the heart attack. Before this happens, signals can appear. Sometimes during stress, lack of sleep, intense physical effort, a moment of fear, and other times for no apparent reason. And watch out, there's not always chest pain. Sometimes it is felt in other parts of the body, and we confuse it with something else. Signal 1. Stomach pain or digestive discomfort. Feeling burning in the pit of the stomach, like gastritis, bloating after eating, or that strange pressure under the ribs that does not improve with antacids. Many people go to the pharmacy, take omeprazole, and continue with their day without knowing that their heart is asking for help. They treat it like indigestion, and that delays medical attention, and that is where the risk increases. The curious thing is that this symptom appears especially in women and young people who never imagine a heart problem. And here is the danger. The heart and the stomach share nerve pathways, so the brain can confuse the origin of the pain. If you notice that this stomach pain appears when walking, under stress, or even at rest, your body could be sending you the first warning. Signal 2. Extreme fatigue or shortness of breath. Suddenly walking 1 block or climbing 2 steps feels like running a marathon. You are short of breath, you get tired easily, or you feel muscle weakness without reason. There is no fever, no cough, no flu, only tiredness that does not fit your day-to-day. This happens because the heart cannot pump enough blood and oxygen. Signal 3. Jaw pain, especially on the left side. That subtle but annoying pain in the jaw, the lower part of the face, or even near the ear. Most people think it is a dental problem or muscle tension, and this is where many lose time. The surprising thing is that many times the mouth is perfect, but the heart is not. Why does this happen? During the development of the body, some nerves connect between areas that today seem to have no relation. So the brain gets confused, and instead of telling you, hey, check your heart, it makes you believe that the problem is in the jaw. Signal 4. Cold sweat and paleness. Suddenly you feel cold inside, as if the blood left your body. The skin turns pale, the sweat is sticky, and it is nothing like sweat from exercise or heat. It lasts a short time and then it goes away. There is the trick. Since it improves by itself, people ignore it. But the heart could be suffering from lack of oxygen and warning you intermittently. Signal 5. Pain in the upper back between the shoulder blades. A strange pain, like pressure or discomfort in the upper back or between the scapulas. It does not change with position, massages, or rest. That is the difference with a normal muscle pain. It is like something pushing from inside. Sometimes it seems mild, but persistent, and it appears and disappears. Signal 6. Numbness or discomfort in the left arm. a strange sensation in the arm and left hand, tingling, weakness, or as if the arm weighed more. It is not always strong pain. Sometimes it is just a discomfort. The curious thing is that it usually appears when walking or making small effort. It does not always start in the chest. Sometimes it starts here, and that confuses a lot. The key is to identify when it is normal and when it is not. If this happens without reason, if you have never felt it before, or if it appears along with fatigue or pressure in the chest or neck, your body is sending synchronized signals. Many people think the symptom is gym fatigue until it is too late. Signal 7. Sudden dizziness or feeling faint. Suddenly the world spins, you lose stability, or it feels like your body is going to shut down for seconds. Some describe it as a brief disconnection. This symptom happens because your brain stops receiving proper blood flow for a moment. And if it is already happening, the blockage may be very advanced. The disturbing fact is that many patients describe these episodes only days before the heart attack. If this repeats, especially after eating or doing small efforts, the body is telling you it is fighting to maintain flow. Do not expect it to pass by itself, because sometimes what comes after gives no warning. Pre-heart attack signals usually last a few minutes and improve when resting. The heart attack lasts longer, does not go away, and can come with nausea, shortness of breath, cold sweat, and a feeling of imminent death. The first hour is the most important. It is called the golden hour. Acting fast saves lives. Why are heart attacks increasing in young people and women? In the last 15 years, they increased more than 60% in people under 40. Main causes: chronic stress, poor sleep quality, sedentary lifestyle, ultra-processed food, chronic inflammation, smoking, passive too, alcohol and energy drinks. Modern life makes us live more connected but less healthy. Do you know someone who had these symptoms before a heart attack? Leave it in the comments, share to save lives, and subscribe. That helps us reach more people. Take care of your heart. I want to see you healthy. I want to see you here. And remember something very important. Your body always speaks before something serious happens. Listen to it. Don't ignore unusual fatigue, strange discomforts, or symptoms that feel not normal for you. Prevention is not fear. Prevention is love. Love for your life, for your family, and for the people who want to see you here tomorrow. Your heart has been with you since your first second of life. Honor it, protect it,